How to administer a subcutaneous injection. So we're going to start off by gathering our supplies. That's going to be 2 alcohol prep pads. We're going to grab an insulin syringe. In this scenario, we've got a 100-unit insulin syringe, and then our peptide or whatever we're going to be administering subcutaneously. In this case, it's expired semaglutide. I'm just using it as an example. First off, I always like to double check the medication, the concentration of the medication, and then the prescribed dose. Just make sure you're taking the right peptide. Second step is going to be taking off this bottom cap of the insulin syringe. As you can see, it's labeled 1 through 100. For most peptides, you're going to be taking it in milligrams or micrograms. So just make sure you're doing the dosage calculations correctly based off of drawing it up with units. So just as an example, we're going to draw this up. We're going to draw 10 units up of this semaglutide. So we're going to start off by drawing up air here. And as you can see, the top of the black plunger is going to be at that 10 mark. All right, the next step is going to be opening our alcohol prep pad and then wiping off this vial. I like to do it for a solid 10 to 15 seconds. And then next we are going to inject the air that we drew up here, like so, in the middle of the vial. You're going to push the air in and then draw back 10 units. And you can fiddle with it a little bit. If you draw too much, you can push it back in, vice versa. So we'll draw that up to the 10. Areas to inject. If you have somebody to help you, they can do the back of the arm. This client does not have a lot of body fat, so not too much in this area. And then you can also do the outer thigh as well. Also doesn't have much body fat there, so probably not our best option. The most common area is typically going to be this lower abdominal region. You want to be at least 2 inches from the belly button, so not getting too close. And we're going to start off by wiping the site here. Another thing to take note of is to always rotate sites. And then we're going to inject at anywhere from 45-degree angle to a 90-degree angle, depending on how much body fat they have. These insulin syringes are pretty small, so either should work. I like to make sure to pinch the skin to make sure I'm getting in the subcutaneous tissue. Okay. And then to safely recap the needle, I use the scoop method. So that's going to be placing the cap on a flat surface and scooping it up like this, recapping it like so. Next, you're going to want to dispose of this into an FDA approved sharps container and then dispose of it appropriately based on your state regulations.